Hi, this is Dr. Tom Rogers at Performance Medicine, coming to you with a weekly podcast of the Common Sense MD. I've got a very special guest here with me today who's a lifelong friend of the family and down through the years. It's Colton Marcum. Now, Colton is a pharmacist that's well known around this area and well known to my family because my father, who was a surgeon here at Holston Valley starting in 1960, was a good friend and collaborator of his grandfather. And of course, then I've known your parents.
Mm-hmm.
I mean, everybody in his family is a pharmacist, but they're renowned for that, and they're certainly great people. And I just love the Marcum family. The Marcums and the Rogers have been lifelong friends and always will be. But the reason I wanted to bring Colton in here today really is it's always educational. And we've talked about something we're going to talk about today in detail before, but and it's Low-Dose Naltrexone, LDN, which Colton has researched as a pharmacist, and actually he's got a personal experience with it. Now, a little background. Colton Marcum, who I knew and watched when he was a tiny kid, probably a baby, and he had you won't mind me telling this, but he probably has the worst case of allergies of any human I've ever heard of. I remember you getting EpiPens multiple times in our church,
Yeah.
and unfortunately, it's just the way it is. But you struggle with that over the years, and
That's right.
now you're into the integrated medicine and ways of looking around things. And as you know, being a pharmacist, we used to repurpose drugs all the time, like LDN, but I hope you don't mind me saying this, but your allergies have been pretty bad. So give me your background medically.
Oh goodness. Yeah, like you said, it's something I've struggled with off and on my whole life. It's I've had years where it's been better, but once I got out of my late teens, they seemed to progress and get worse again, and especially my eczema, and my atopic dermatitis, and asthma, the whole nine yards. And then, I've just it's been antihistamines. And at one point I tried a biologic. It was a life changer for about a month, and I developed an allergy to it. And it had a extremely long half-life, so it was in my system for a good bit. And that made me hesitant to try anything on the biologics, spectrum again. Not to say that, there's not one out there, but just constant rashes, itching, just everything comes with that allergic sense.
Like, give me an example. Like, we're talking anaphylaxis. We're not just talking about itching, and so we're talking about anaphylaxis. How many times have you had to take an EpiPen for
I have no idea. 20, 25. I'm not sure. Enough that I've lost count.
More than anybody I know. But,
Yeah, certainly.
Enough so that I hope you have one around at all times. I'm sure you do.
In my pocket, yeah.
But certainly you've come through this thing, and really we met a few months ago, I think, and collaborated on maybe how to go about treating this a little bit alternatively. As you know, I'm a physician that is kind of a blend between traditional and alternative. I want to know the best of both, and I'm going to use the best of both. But so at the time you were considering taking LDN, and you sat down in my office and we talked about it. And I hope we have a before and after picture of your leg, because you had some pretty bad rashes.
Yes, we've
Pretty
got one.
Remarkable. And we'll try to put it on there for you. But tell me, when you started thinking about LDN and really how it affected you.
After I started taking it?
It
was, they say on average it can take up to 3 months to see results, but really about 30 days in, I was just, the visible rashes were gone. Even enough that the customers in the drugstore were noticing. They're saying, hey, you look better, or you don't look as bad today. And that itself was just, you're embarrassed sometimes when you're covered in welts on your arms, and it's been a life changer. It's been an amazing experience. I have not had any, as with some of your other treatments, you've got a bunch of side effects or drowsiness and things like that. And it's all been positive for me.
This is definitely a safe treatment. And for those of you that don't know much about low-dose naltrexone, briefly, and you can go back to some of my previous podcasts about what it is and how it works, but basically when you think of naltrexone, you think of an opiate antagonist. In high doses, we use it to give to narcotic addicts and alcoholics because it takes away the high they get from this. You know, I've treated a lot of people for this in the past, but what we're using it for is an entirely different thing. Low-dose naltrexone is entirely different, not to be confused with naloxone, Narcan. It's a cousin, but it's a totally different thing. So low-dose naltrexone, and we're talking about 1 milligram, 3 milligram, 4.5 maybe, as opposed to 50, 100 when we use it for that, kind of tricks the brain into releasing its own endorphins. So it also has great antioxidants, anti-inflammatory properties. It's basically, it helps cravings. We use it for a host of things for many years, from fibromyalgia to weight loss. I mean, it's half of that prescription medicine called Contrave that we use for weight loss, which is a combination of low-dose naltrexone and Wellbutrin, which is an antidepressant medication, also used for other things. But the way it works is just phenomenal, especially for autoimmune diseases. And I know you dispense it in your pharmacy, especially since your experience, because you're a compounding pharmacy. I mean, this is something that you're not going to hear much about from traditional doctors or even traditional pharmacists. You got to go a lot deeper than that, but it's a really, really good treatment for many conditions. Almost everybody that comes in with Hashimoto's, I use that, and you can watch their antibodies just go down when they use this. We use it for weight loss. We use it for fibromyalgia, which is a real condition that nobody knows why. There's no test for it. But we use it also for long COVID, long hauler syndrome. We talk about that a lot in the podcast. And in my research, I found out that Stanford's long hauler COVID treatment clinic, their main go-to is LDN. Did you know that?
I didn't know that.
Yeah, it's really interesting that a place as academic as Stanford would start using this, because doctors and probably pharmacists too, you can attest to this, but they're kind of really hesitant to go use repurposed medicines and medicines that aren't brand name pharmaceuticals.
Sure.
And we could get into a dialogue about, pharmaceutical companies and drug companies and all this and the FDA, and we don't want to do that though. It'd take too long.
Yes, sir.
But yeah, I mean, a lot of your heavy hitters are using LDN for long COVID, and I really I haven't seen any side effects. I have seen of people it just didn't work much on. It's not going to work overnight. Probably the only thing I've seen with it is more vivid dreaming.
I have had vivid dreams. Not to the point I would call it a side effect. It's kind of an adventure in your sleep sometimes.
Well, it means you're getting more REM sleep, right?
That's right.
Which is
Correct.
a part of deep sleep, so it's actually a good thing. I have had a few people, I had one yesterday, that didn't like the vivid dreams too much. And so I told them, take it during the morning.
Sure.
And it works fine. It doesn't really put you to sleep. But if you have sleep difficulties, it will help you sleep, as evidenced by the Oura Ring that I wear a lot. I've tried it, and it definitely gives me more REM sleep, no doubt about it. But we've even used it for plain osteoarthritis.
We've got quite a few patients on it for arthritis. That and irritable bowel symptoms. And that's another thing I've noticed a huge change just with the food allergies. I score to everything. And so I'm constantly, taking in things I'm sensitive to. And I have noticed a great improvement in my GI tract.
That is amazing. Yeah. So I'd forgotten about that. We did do some food allergy tests on you, didn't we? And
we had some old tests we looked at. We need to revisit that and do some more, though. Yeah.
We probably need to do a GI map on you if we haven't. But we did that, or yeah. That's pretty helpful, isn't it?
Oh, extremely. That was did that probably a few months before we met, and
Yeah,
did the treatment. And definitely, that was an improvement. And then the LDN on top of it was just made me want to eat again. So,
So your life has definitely changed for the better, just from LDN.
Mm-hmm.
And it allows you not to have to take a biologic.
Correct.
Biologics meaning medicines like Humira that are going to cost a lot and potentially have side effects. And then a lot of times they quit working, don't they?
They do. I've seen a patient I know really well has been through almost every biologic out there for rheumatoid arthritis, but they're on one for a while, 3-6 months, and then you eventually kind of run out of options, and it's tiring for the patient to get insurance approvals and deal with all that.
It's a big hassle.
It's a huge hassle.
LDN, how much is LDN? When you have it at your pharmacy, how much are you able to give like a month's supply for?
It's around $40.
Around $40?
Yeah.
Insurance is probably not going to pay for it.
No, insurance ain't going to. I'm sure maybe there are pharmacies out there that, actually I doubt it. I'm not aware of it being paid for anywhere. And
it's really strange that what I've seen as a doctor, and you see this every day probably in your pharmacy, but there's not a lot of transparency with what your insurance is going to pay for anymore, is there?
No, there's not.
I mean, there's a huge difference as well.
Oh yeah, and you run into pharmacies getting underpaid sometimes too.
Oh, that's for sure.
Yeah.
It's really just a crime, I think.
Yeah.
I always liked the independent pharmacies. I've always wanted to work with them, kind of like I like local banks.
Well, we appreciate that. Of course, I'm partial, but
Well, I mean, your granddad started that tradition, and a lot of times I think with pharmacies, like the big chains are just not real personable. It becomes like rat on a treadmill.
I don't think they have time to be. There's great pharmacists and technicians there, but it's a corporate world, and they've got their marching orders and have to do what they've got to do. So,
it's certainly not the pharmacist's fault.
Exactly. So
it's corporate America. Same thing with me in my practice. That's why I'm independent. I do not want to work for a large group or a hospital because I wouldn't be as good a doctor.
Yeah, it's all about the personal relationship and not, just checking boxes.
And having time to talk to the patient.
Exactly.
Do you have like a time that you counsel patients when you give them medications?
We do, upon any new medication, but then anytime somebody has a question, we've always got a couple pharmacists there, and we'll always step aside and take a moment.
You guys are even open on weekends, aren't you?
We are, Saturday and 9 to 5 Saturday and 1 to 5 on Sunday.
Well, that's pretty impressive.
Sunday's busier than Saturday, usually.
Is that right?
Yeah.
Was your granddad open on Sundays as
He
well?
was. He was.
That is incredible.
In fact, when I took over, the only day he was closed was Christmas.
Is that right?
We're now closed on Thanksgiving and Easter. But
that is remarkable. I certainly love your pharmacy. I love your family. Anything else we need to cover on LDN and maybe allergies in general? For somebody that, we live in East Tennessee. With allergy capital of the world, probably.
Yes.
And you're certainly one that's had a lot of multiple allergies. You've been on allergy injections, desensitizations. Any other tips you can give folks, especially these young kids that suffer from this all the time? I mean, I had hay fever during the fall, and back when I was having that pretty bad, I took Benadryl or Dramamine or some of the old-timey medications that made you drowsy. Now we have some pretty good ones, like we have nasal sprays, we have Claritin, Zyrtec, all these newfangled ones that are a lot better than the old ones because they don't make you too drowsy. But in general, what advice on allergies would you give families, especially kids?
As far as seasonal allergies, I mean, if you've been outside, as soon as you come in, take a shower. I mean, you've got pollen residing in your hair and on your clothes. Nasal sprays are, I think, often underutilized.
Like the fluticasone?
Fluticasone, and even just get a squeeze bottle and use a saline rinse. And just clean the nasal passage. Nasal health.
Yeah, I bought a Navage system that I really like a lot. I talked about it on one of the podcasts, but it kind of forces it in and pulls it out.
We sell them. I've got one at home. I tend to use just the squeeze bottle, just convenience, I guess. But yeah.
Interesting. So clean the sinuses out. Take a shower after you've been outside.
Yeah, and then avoid it if you can. I mean, I like to be outside, so there's, I'd probably be better if I sat inside all day, but
Nobody's going to do that.
But nobody wants to do that. So, but learn what triggers you and just try to be careful with it. I don't know. I fuss at my nephews for wearing shorts in the grass because then their legs are itching. Wear long pants.
Are you extremely sensitive to other things like poison ivy or mosquitoes or any of that?
That's the odd thing. I do not get poison ivy. I pulled some out of the garden the other day. It does not bother me.
That is really
And mosquitoes actually don't. I've just always said they don't want to bite the skin. So I mean, they don't tend to bother me. So
that is really interesting. What about antihistamines? Like, do you have favorites like Zyrtec, Claritin, Allegra?
I'm a Zyrtec fan. I think it tends to make you a little more drowsy than some of the other ones, but that's what I take at night. And former allergist had me actually taking 2 at night and 2 Allegra in the morning. Wow. I had to slow down on that and drop the Allegra because I was zonked all the time.
Yeah,
but
I agree. I think Zyrtec's a little more potent, but take it at night.
It seems like from what I see, people are often have their preferences. So, well, that doesn't do anything for me, but Zyrtec's my favorite. Chlorpheniramine is great. I mean, it'll make you drowsy, but if you're having a bad flare up, it's out of your system in about 4 hours. And I mean, it's old school, but it's a go-to.
Sometimes the old school medicines we don't use because you hear all the advertising for the new stuff. I personally think that drugs shouldn't be advertised on TV as much as they are.
I agree. I've never thought about that, but I definitely think that's.
I mean, here you're sitting watching the Super Bowl, and the ad comes on. Do you have small cell cancer of the lung? You might want to tell your doctor about this chemotherapeutic drug or this new biologic. I'm thinking to myself, if you have cancer of the lung and your doctor doesn't know about that medicine, you better go to another doctor. But I think most of the advertising dollars in our country are spent on pharmaceutical drugs.
Oh, definitely.
It's outlawed in other countries.
And that's raising the price for the patient. I mean, they've got to cover their advertising bill somehow. So.
And then you get into all these PBMs, pharmacy benefit managers, who they soak up all the profits, and they should be illegal as well.
I agree. I don't know if I should say that on the podcast, but yes.
I mean, yes. This is an open forum.
Yeah, yeah. Yes, the PBMs are. It's a nightmare for the independent pharmacists, especially. Yeah.
So are you thinking that if you say something bad about it, you may end up on the bottom of Boone Lake or something?
I don't know.
We're kind of kidding about that, but so PBM managers don't come after us, okay? But if you do, we'll be ready for you. But anyway, I love practicing medicine. You love being a pharmacist. Yeah. You certainly think outside the box. Your wife is a pharmacist.
Correct.
She's an incredible person.
Well,
I need to get her on the podcast.
You do, yeah.
What are her interests? I know she does a lot of compounding.
Hormones.
Okay.
She's self-taught, and we've been to a bunch of conferences together over hormones has become kind of her passion. So,
that's amazing. That's something we do a ton of bioidentical hormones. There's so much confusion about hormone therapy and so many misconceptions that really hurts patients, especially women who are more complex hormonally and who, we like to push back menopause on because they just stay much healthier.
Sure.
If you could delay menopause forever, that's what I would want to do if I was a woman.
Definitely.
I need to get her on here for talk about hormones and women.
Yeah, that'd be great. I'm sure she'd love to.
Yeah, that'd be fantastic. So, Colton Marcum, pharmacist and friend and patient,
That's right.
sufferer of allergies to the extraordinaire. You like LDN. It's you told me it kind of changed your life in a way.
It was definitely a life changer. And I think if you have any questions, reach out. It's maybe not a cure-all, but it's definitely worth giving a shot. And I know I'm sold, and it's improved my quality of life, and I think that's what it's all about.
Well, that's a great testimonial. if you're suffering from rashes all the time and itchy, watery eyes, sneezing, asthma, which you probably have as well, there's help out there, and you don't have to keep suffering. So there's another option called Low-Dose Naltrexone for some of these things that is so widespread with what we use it on. You need just to ask about it. Would LDN help me with this situation? And certainly you can go to Colton at Marcum's Pharmacy and ask them about it. They're very willing to talk to you about it. And, sometimes when I've had a condition that I've gone through, and it is so more relatable to the patient. I mean, you really want to help that patient because you know what it's like.
We had a patient the other day that started LDN, and she was asking some questions, and she said, "Well, do you have any experience with using it for skin disorders?" And I was like, "Well, actually, I'm your guy." So she just started about a week ago, so we'll see we'll follow up on her soon, see how she's doing.
She hopefully will watch this and look at the pictures, but that's testimonial in itself. But Colton, thank you so much for coming on here today.
Thank you for having me.
A lot of good information. Think about Low-Dose Naltrexone. Certainly check out Marcum's Pharmacy. They're amazing down there. And I love your new building, too.
Oh, thank you.
I can't imagine how much renovation you had to do to that property.
We don't want to do it again, but we're thankful to be there.
Listen, Colton, thank you so much.
Right. Thank you.
Any questions, please don't hesitate to contact either one of us. We'll see you next week.